Good afternoon, everybody. I'm Michael Barasch of Barasch McGarry. I'm so glad you joined us for this afternoon's webinar on bladder cancer, and it is one of the most common cancers linked by the World Trade Center Health Program to the World Trade Center toxins. So in light of the fact that last month was Bladder Cancer Awareness Month, we thought it was appropriate to help our clients, but also non-clients. So I hope you'll learn something. And most importantly, it is our hope that you will help us spread a word about the rights available to the 9/11 community, not just first responders. So we're going to start with a short video that sets the table. And then I'm going to introduce you to the team.
The first thing that I hear from the non-first responder community in Lower Manhattan is, look, I'm sick, but I don't deserve anything. I'm not a first responder. I just lived here. I just studied here. I just went to school here. I just raised a family here. Your presence here was an act of courage and resilience. The first responders, I'm in awe. But I also am in great awe of those who came back to a war-torn neighborhood that was clearly toxic. We knew it, but you stayed anyway, and you allowed this area to grow and to become the hub, but it's your courage and your resilience that brought this place back. So please, I urge you, access what you are owed.
Over the last decade, we have all fought very hard so that everyone has access to the health care that they need. It is very important that every community member who lived anywhere south of Houston understands that you are covered. You are part of the group of people that have guaranteed health care if you have a 9/11 related disease.
I was on my way to work when the first plane hit. I was working for Goldman Sachs. I actually worked for them for a total of 21 years. I always thought that those programs were geared for the firemen and the police officers, but I'm one of the victims of that.
So we have taken on, with all of these advocates here, the task of trying to get everyone to understand that they have rights, and it is imperative that they sign up.
One of the really surprising things about our research is that an event in 2001 can continue to have echoes 17 and 18 years later, such that it is as though never smokers are smoking 2 packs a day.
My law firm represents over 15,000 people in the 9/11 community. And the majority right now are first responders, but every single day we hear from more and more survivors because we're doing this outreach. Basically, to be entitled to compensation, you need to prove that you were below Canal Street or on the Fresh Kills landfill, either caught in the dust cloud on 9/11, or for 24 hours during the month of September 2001, or for 80 hours, which is just 2 full work weeks between 9/11 and May 30th of 2002. And you need to get 2 people to sign an affidavit attesting to the fact that I saw him. I worked next to Joe. I went to school next to Francis. That's all it takes. There's a reason why my firm takes all this so personally. I have 6 young people who work for me who have lost a parent or a spouse as a result of World Trade Center toxins. 9 people in my law firm, including me, are cancer survivors. The information you get from us is going to be compassionate, and it's our pleasure to help you.
With me today are my partners, Dana Cohen, Dom Penson, James Steiner, Lee London, and we are honored today to have Liam Lynch of NICOSH with us at all. Liam is going to be speaking about the World Trade Center Health Program and Logistics Health, Inc., which is part of the World Trade Center Health National Program. And also with us today is retired Deputy Chief Richie Allies of the FDNY, who's going to be speaking about the health program as it pertains to responders, which is perfect. So thank you both for coming today, because half of our audience today are responders and half were civilians. So let's start with the first slide. As you heard Senator Gillibrand speaking, there are 2 separate geographical areas. The area you see on this slide here in blue is bigger than the area in orange. And that area in blue goes 1.5 miles from ground zero, which means it includes parts of Western Brooklyn and all the way up to Houston Street. Anybody within that area is entitled to enroll in the World Trade Center Health Program, the free World Trade Center Health Program. And I implore all of you to please make sure none of your friends, neighbors, former coworkers, former responders who were with you, make sure everybody gets into this program. And you'll hear why in a little bit. And as you can see on the map, there are many schools and big companies, but also many small little companies. Like my law firm was only 15 people at the time, and half of those people have either died or had cancer. So please, it's important that everybody get into this program. And sadly, as you can see on the right, while 80% of responders have enrolled so far, which is wonderful, the unions have done a great job informing their members, less than 10% of civilians have enrolled in the free health program. We want to change that. All right, and also we'd be remiss if we didn't mention Pentagon responders are also eligible. Now, they don't have to have been there for nearly as long a time as the World Trade Center responders, but they are eligible. Same with the Shanksville responders. But sadly, only 5% of the Pentagon community has applied to the health program so far. All right, Lee, would you please take us through these most commonly presumed illnesses?
Sure, and thanks everyone for joining. We really try to do our efforts to get the word out there about 9/11 exposure and the amazing benefits available. When the Zadroga Act was created, you have the World Trade Center Health Program on one side, which offers free medical care for the rest of your life, and you have the Victim Compensation Fund on the other side. The Victim Compensation Fund has now been permanently funded and extended till 2090 to outlive us all, to outlive anybody who was in the 9/11 exposure zone. That's why it's so important that if you know somebody that was there, to let them know so they register. But the biggest cancer that we are seeing now, other than bladder cancer, which is running rampant in the 9/11 community, is skin cancer. The skin is the largest organ on the body. Skin cancer is covered. Most people, when I ask, have you been diagnosed with skin cancer? They say no. Then I say basal, squamous, or melanoma, and they say, oh, I was diagnosed with basal cell, and I said, that's covered. So we just want to make sure people are aware that these cancers are covered. And I want to get through the misconceptions that many people have when they listen to their private doctors and they're not going to the World Trade Center Health Program, or they think that they have family history of this. It's a presumption that if you were there and you have the hours to support it from in the 9/11 exposures, and it is presumed your cancer and your respiratory and much more severe non-cancer conditions are covered by the fund. Now, you have to ask questions. If you don't know if your condition is covered, if you're wondering if you're suffering from this, 99% someone else in the 9/11 community is suffering from it. So that's why we are encouraging everybody to join the World Trade Center Health Program and to register with the Victim Compensation Fund. And one of the major aspects of it is that the fund has been extended. So God forbid you initially come down with something and you move forward, we can always amend your claim. God forbid something else happens in the future. Most of my clients and that suffer from these types of cancer conditions, these cancer conditions come out of nowhere. And we don't want you starting this process or having to deal with getting presence documentation when you're sick. We want you to start this process now, even if you have no ailments whatsoever. So you gather your documentation, and then God forbid something happens in the future, we can move forward, or we can amend your claim if you already got something for an initial award. But it's very important to review the conditions that are covered, because the more people in the program, the more conditions can be added to the VCF. And that is key. We need the 9/11 community in the health program so they have the research to add new conditions, because as time goes on, more conditions will be coming out, just like mesothelioma, which takes the longest latency of over 11 years to be linked to your 9/11 exposure.
You know, that's a great point, Lee. And also, so many people think they're not eligible because of a family history. And that is not a factor here at all. There is a presumption that if you were there and you were exposed to the toxins, you are eligible. Your illness will be deemed linked to the World Trade Center toxins. And I want to make a special mention that there is so much information on the CDC website. So please feel free to go to the cdc.gov/WTC website. Deadlines. Okay, well, before we even get into this, I want to, please, I urge all of you to go to the Victim Compensation Fund website, and that is vcf.gov. And first, let me say this. There is, in general, there was a 2 years from the date that an illness was officially certified by the health program. That's how long people had to register a claim. Also, families had 2 years from the date of their loved one's death to register a claim with the Victim Compensation Fund. Well, so many people missed that deadline because one of the things that Lee alluded to a minute ago was that cancers weren't even linked to the toxins until 2012 and 2013. So if your husband died in 2007 from prostate cancer, or your wife died of breast cancer in 2010, why in the world would you ever think that eventually these cancers would be added? You wouldn't. So really hundreds, if not thousands of people missed this deadline. And the special master of the Victim Compensation Fund did a wonderful and compassionate thing. She extended that deadline for anyone who didn't register within that 2-year window. But that window expires on July 29th, 2021. Now, just 2 weeks ago, the special master announced that she would not extend this deadline again, but she did say there would be exceptions whereby people could submit claims. We are still waiting for the special master to upload these rules in writing. And once we have those rules, we'll make sure that we share them with you. But as I said a minute ago, you can go to the VCF website for up-to-date changes. It's really very compelling and informational. So please take advantage of that. Liam, let's start with you. First of all, I want to thank you again for joining us. Tell us a little bit about NICOSH and your relationship to the World Trade Center Health Program.
Absolutely. Thank you so much, Michael. It's a pleasure to be here. So my name's Liam. I'm from an organization called NICOSH, New York Committee for Occupational Safety and Health. We're a small nonprofit, but we have a long history serving the workers of New York City, and we were there right after 9/11. My colleagues were, down at the site passing out respirators, and then really tried to advocate for healthcare and protection and compensation for the responders and the survivors of 9/11. So we've been serving this community for a while, and it's really an honor of a lifetime. So I'm here to talk about the World Trade Center Health Program. This is one component, like Lee was saying, of what we're talking about, the VCF being the other component, the compensation piece. So the health program provides free, no cost for both survivors and responders, health screenings and treatment for those who were impacted by 9/11. And there's over 100 different conditions that they provide treatment for. We just saw it was 68 different cancers are covered, but there are a whole host of physical conditions that are covered, aerodigestive, all the way from, GERD, right? And also mental health conditions is covered in the World Trade Center Health Program. So that could be PTSD, anxiety disorder, panic disorder, a whole host of mental health conditions that the program provides treatment for. And the doctors and physicians that are in this healthcare program are specialized in treating responders and survivors. They understand the unique circumstances of the conditions. They have experience in caring for this population. And that's really what makes, I think, this program really stand out. Besides the fact that it's no cost for these conditions, is that the physicians and the healthcare professionals that are a part of it really understand and want to care for this community. And if you opt in, your patient data can be used for extremely valuable research that will help us all care for responders and survivors in future disasters, but this one as well, because like Lee was saying, this program is not static. It's designed to evolve with the changing needs of its patients. So, the more data that NIOSH has, that the scientists have to connect conditions to 9/11 exposure, then future conditions could be possibly covered. So, when I first started this work, cancer was not covered. And then now we have, over 68 cancers covered today in the program because they made that link through the research that was available. Now, a couple of things. One is that this program is nationwide. You do not have to live in the New York metro area. So if you know people who live elsewhere or who have retired and relocated elsewhere, you can receive care in all 50 states. That program, that piece of this program is coordinated by Logistics Health Incorporated, LHI. It's a nationwide provider network, all 50 states and Puerto Rico as well. And then, I think most importantly here is that early detection can save lives. You may feel fine. Your colleagues who were a part of this may feel fine today, but you may not later down the line. For some of these conditions, there is what we call, a long latency period, which means that you can be exposed in 2001, but, to all of the debris that had asbestos in it, a whole bunch of, other World Trade Center derived contaminants. And you'll feel fine, but you might develop a condition 20, 30, even 40 years later. And so we know that to be true for asbestos exposure, which certainly was down at the World Trade Center site. So it's really, really important to get into the program so that you can have an annual monitoring exam for responders to get checked up. I will say that for survivors, you have to feel that you have some kind of symptom connected to 9/11 exposure. That could be a cough, that could be anything, that could be, mental health condition. But for responders, you get a free mental health checkup, regardless of whether you're experiencing any symptoms at all. So there's a lot to go into this, but that's just kind of the program in a nutshell. So I'll swing it back to you, Michael, but I'm here for any questions at all.
Thank you, Liam. And this is a perfect time to go to Richie Alley. So Richie, you were with the FDNY. As a matter of fact, you were a deputy chief. You've since retired and become director of 9/11 outreach at our law firm. Can you talk about the health program and the benefits available to responders?
Sure. And thanks for inviting me, Michael. It's always an honor to be with everyone. I want to say hello to the survivors and to my fellow first responders. For me, going back all the way to 2007, when I was the legislative and political director for the Fire Officers Union in New York City, is when the fight to get this law passed in Washington really heated up and began in earnest. And thankfully, we were successful in 2010. It's been a long road because the law had to be renewed, and then it had to be refunded, and now it's permanently in place. So I understand survivors that don't get the information because it seems like, everybody was in Washington, this great law got passed, and everybody went home. First responders, fortunately for them, they're usually part of a labor union and organization where they're aware of this, and that's why when Michael gave the statistics, there's so many more first responders. We're at 70, 80%, where survivors is less than 10%. Be that as it may, it's a source of frustration for me to find out, even at this late date, that many first responders either are not aware or they don't bother to enroll. So I've been, since my retirement from the fire department in 2016, in the World Trade Center Health Program, and I go every year for my annual medicals. I also have a personal physician, so I didn't blow that away. I just kind of space it out every 6 months. And when you go to your primary care physician, he knows your family history, knows your personal history, and most doctors are reluctant to just send you for tests that may not be necessary. You don't have any symptoms, you don't have a family history. Well, the World Trade Center Health Program takes a different tack, which is what I like. They go on the assumption that you have a family history of everything because you've been exposed to everything. So they're very aggressive with sending people out for tests, colonoscopy, a endoscopy, for the slightest symptoms. Whatever your complaint is, they're going to send you out and make sure that you get examined appropriately. So the doctors and nurses in the health program are specialists in 9/11. The average doctor anywhere across the country, because this is a national program, may not be specifically in tune to the specific illnesses and diagnoses and things to look for in a first responder or in a survivor who has been exposed to these toxins. I was diagnosed and later certified for skin cancer back in 2010. Then being in the New York City Fire Department and the health program was already in play, even though I was active, you also get your mandatory annual medical exam and also a World Trade Center evaluation. And even though, as Lee stated and Liam stated, that skin cancer isn't something that's screened for in the health program, it's something that's compensated for by the Victim Compensation Fund. Well, as I said, the doctors and nurses there are really good. The doctor that was there was examining me and noticed something on my neck. I hadn't, and it had been there for a while, and recommended that I make an appointment with a dermatologist. I didn't think it was going to be anything, because it really, to be honest with you, it just looked like a freckle on my neck. Anyway, long story short, turned out to be a basal cell carcinoma, where I was, was treated. I mean, skin cancer is not normally a life-threatening illness, but it can be. Had a colleague a year ago, and it's not, we've all been taught like, well, sun exposure. Well, yeah, that is a cause of skin cancer, but in the 9/11 community, the toxins at ground zero, the pH was the same as Drano. So those fine particles that got on people's bodies have wreaked havoc, basal cell, squamous cell, and melanoma skin cancer. Well, a colleague of mine who was Italian with dark olive skin developed a rash on his arm. He had no other conditions. Actually, he's in impeccable physical condition, runs marathons. He decided to go to a dermatologist after hearing, a lecture about it. And the rash on his arm turned out to be nothing, but the doctor noticed a slight discoloration on one of his fingernails. He didn't like it, went in, did a biopsy. The biopsy came back. Not only was it skin cancer, it was melanoma, the most aggressive form. They had to cut the tip of his finger off. He had to undergo some chemo. But the moral of the story is that he's alive and well and in good health. Very easily could be telling a different story had he not gone to the dermatologist, because those cancer cells find their way unchecked into the lymph node system and break out somewhere else. And it could be an even worse tragedy. So yeah, I can't say enough good things about the World Trade Center Health Program. Back in the day when we were trying to get this law passed, even though we knew that the compensation was going to be extremely critical to families that were losing their breadwinner. But the World Trade Center Health Program, for me, is on the top of the list and the very best of healthcare in the country.
Thank you, Richie. So, James, would you please share with us some of the benefits of registering with the Victim Compensation Fund?
Yes, and you heard Liam and Richie talk about the benefits available from the World Trade Center Health Program. Remember, when the Zadroga Act was created, it created two programs, one being the World Trade Center Health Program, which covers the medical costs, like you heard, and the second program being the Victim Compensation Fund, which actually provides monetary awards for 9/11 related illnesses and for things that come along with them. So you see on your screen here some sample awards or non-economic loss amounts for non-life-threatening illnesses, things like asthma, GERD, obstructive sleep apnea, and sinus conditions. Awards range from between $20,000 to $90,000. You see skin cancer as well. You heard some different types mentioned, basal and squamous cell being the most common types. And of course, you have melanoma as well. And awards for these conditions range from between $90,000 to $250,000. And unfortunately, in the 9/11 community, you have more life-threatening illnesses like bladder cancer, like prostate cancer, kidney cancer, and the like. So that's where you typically see awards ranging from between $200,000 to $340,000. And now those are awards for the pain and suffering associated from certain illnesses. But the VCF recognizes that sometimes there's more that goes into it. It's not just your pain and suffering. For instance, you may have a World Trade Center disability pension or another disability determination based on your 9/11 related illness. In such a scenario, in addition to the $250,000 you may receive for your bladder cancer, you can also make a claim for the earnings that you lost as a result of that condition. Not only that, if you have out-of-pocket medical expenses related to your bladder cancer that were incurred before you were certified for that condition, you can make a claim for reimbursement so long as you meet the minimum threshold. And one of the great things about this program is you never waive your right to amend your claim in the future. And what I mean by that is, a lot of times when we're speaking to people who are interested in making a claim, they may say, you know what, I only have asthma now, but what if I get bladder cancer later? I don't want to make my claim now and then, forego anything if I'm diagnosed with a more serious illness down the line. And one of the great things about this program is that you can make a claim now for one condition, even accept your award. Let's say you do receive an award on the lower end of $20,000. You can accept that, and then if years later you're diagnosed with bladder cancer or another condition, you can then amend your claim to request additional compensation based on that new diagnosis. So unlike a traditional lawsuit where you settle once and that's the end of it, the VCF, you can always go back and amend your claim, which is one of the great things about the fund being extended permanently through the year 2090.
Thank you, James. Again, I want to say something that the Special Master's Office is always telling people. Frankly, you don't need an attorney. You can do this by yourself. I mean, there's a lot of work to do. And as Lee mentioned, as every year goes by, it gets harder and harder to prove that you were in the exposure zone. But again, if you have questions, I invite you to go to the VCF website. There's a lot of information there, and I just wanted to be transparent that having an attorney I think is a good idea, but it's not mandatory. Dom, would you take us through the benefits of the Victim Compensation Fund when it comes to wrongful death claims, and also talk a little bit about the deadline?
Yeah, thank you. I'd like to. Very often families don't know what their loved ones were diagnosed with, certified with. Sometimes they do, sometimes they don't. And for this reason, this is why we're urging everybody to please spread the word. There's a month to go. If you know somebody who was down there, or somebody who lost a loved one to a World Trade Center illness, just tell them about the program. Tell them that there's a deadline. Tell them to look into it. Tell them to reach out to us or another law firm or contact the VCF and find out whether or not the deadline would apply to them. Very, very important. With respect to the awards, when you file for a deceased claim, not only is the estate of the person who passed away entitled to an award for various categories that apply to deceased claims, there are also, if the victim never filed a VCF claim while alive, and therefore did not receive the benefits that James described a few moments ago, then the family can recover those very same benefits. Just they step into the shoes of their loved one, they can get those benefits. It's not too late. In addition to that, the family is also eligible for wrongful death benefits. So more money for pain and suffering, for the victim's pain and suffering. So, for example, in the what you see on the slide before you, it talks about an amount $250,000. That is a standard amount for the victim's pain and suffering if they passed from a World Trade Center related illness. In addition, again, if there are lost earnings, if the person's work life was cut short by their death, their family can recover for those lost years of earnings that could have been expected to support the family. There's a category of damages called replacement services that has to do with the value of the services around the house that the family lost when their loved one passed away, and the family can recover that. There are direct awards, typically $100,000 awards to surviving spouses and other dependents. Burial costs are reimbursed by the VCF. So all of these are available as benefits to the family in addition to the award that the victim could have recovered in life if the victim didn't. And you add it all up, Michael, and these awards can be very substantial. They can be in the hundreds of thousands of dollars. They can be in millions of dollars.
Dana, would you summarize today some of the messages we're trying to get out there to our visitors?
Of course. Thank you, Michael, and thank you, everyone. So what should you know and what should you do now, even if you're already in the program? Remember that the Victim Compensation Fund is not just for you. It's not just for me and the other members of the 9/11 community on this panel. It's also for our families. And we have peace of mind knowing that if something were to happen to us, our families would be entitled to substantial benefits from the Victim Compensation Fund. But we have to make sure that our families know it. And we have to make sure that we do the things we have to do so that they can receive those benefits, they can apply for those benefits, and they can get the help they need if they're ever entitled to it. So the first thing you should do is talk to your families. Make sure they know that you were there. Make sure they know about the Victim Compensation Fund, and make sure they know that if you were to ever pass away from a 9/11 illness, that they would be entitled to apply for this program. And when I say they, who? Well, you actually get to appoint the person who will do that. You do that by making a will. And in your will, you'll name an executor, and the executor is the person who will be in charge of bringing this claim. So you can decide who you trust to do that. You can talk to that person, and you can have everything in order for your family. That's the first and most important thing that you have to do. We're a community. The 9/11 community is a strong, beautiful community. We support each other, and we share information with one another to help each other. The Victim Compensation Fund isn't really the primary way that information is getting to survivors, to families, to responders. The primary way that people are learning about these programs are from the 9/11 community. So talk to one another. If you know someone who was there, don't assume that they know about these programs. If you are not in the World Trade Center Health Program, you should do so. Register. It's a tremendous, tremendous program. You've heard a lot about what it can do. And it's the first step to getting certified, which you need in order to apply to the Victim Compensation Fund. Secure your proof of presence. It's 20 years later. It's getting harder and harder to do. You don't want to leave that to your family. You don't want to leave it to your family to have to find witnesses, to have to find documents. The more time goes by, the harder it is to do. So work on that now. And take care of your health. So see a dermatologist, do the screenings that can help us detect illnesses early so that you can stay safe. If anything were to ever happen, catch it early, and that's your best chance for beating it. So eat healthy, take good care of yourself, and go for your screenings. Go for mammograms, go for colonoscopies, go for dermatology exams, everything that you can, and go to the World Trade Center Health Program for your screening. Get a will. We talked about that. Update your beneficiaries. It's something sometimes we don't think about. And maybe you're married, but it's your mother who's from long ago, but who's named as your beneficiary. Well, you want to fix that. Maybe you're divorced and it's your ex-wife who's your beneficiary. We have heard of someone who put his dog as his beneficiary, and you don't want to leave that like that. So think about it. If you haven't looked at it in a while and you need to update your pension plans, your annuities, your bank accounts, your life insurance plans, you should take care of that. And call us, if you have questions, if there's anything on your mind, that's what we're here for. We're here to help.
Right. And I just want to end by saying, I know that today's webinar was for bladder cancer. The reason we made this more general than just bladder cancer is because so many people with bladder cancer have the same issues as all the other cancers, which they, for the most part, they don't register because they think it's a family history. They can't imagine that bladder cancer was caused by their exposure a dozen years ago. So I wish we had a doctor on. Our doctor, who was supposed to be on this afternoon, had an emergency and wasn't able to attend. But I hope the rest of you did get something out of this. It's our pleasure to help you. If you have any follow-up questions, please email us, call us, or as I mentioned earlier, reach out to the CDC or the VCF. You have enormous resources. Take advantage of it.